Today, we're diving into something that a lot of men will face at some point, the PSA test. It sounds like it should be a simple decision, right? But it's actually filled with a lot of complexity. So we're going to break down all the facts, pulling from top health organizations here in the UK to really help you make a choice that feels right for you.
So let's just cut right to the chase, shall we? Is this just a simple blood test that could be a lifesaver, catching a dangerous cancer early? Or is it a gateway to a whole lot of unnecessary stress, invasive procedures, and maybe even treatments you never really needed in the first place? That's the big question we're going to explore together.
Okay, so before we can really get into the test, we've got to understand the prostate gland itself. Let's cover the absolute basics. So here it is. The prostate is a small gland, about the size of a walnut, and it's tucked away just underneath the bladder. Its main job is helping to make semen, but because of where it is, you can see how any problems with it could affect things like urination and, of course, sexual function.
So why all this focus on a tiny gland? Well, because prostate cancer is actually the most common cancer diagnosed in men in the UK. And get this, a staggering 1 in 8 men will be diagnosed with it at some point in their life. That is a huge number for anyone to think about.
Now, that 1 in 8 figure, that's an average, right? The risk isn't the same for everybody. For most guys, the risk really starts to go up once you're 50 or older, or if you have a close relative, we're talking a father or a brother, who's had it. But, and this is so important to understand, the risk for black men is significantly higher. It jumps to 1 in 4.
All right, we've set the scene. Now let's get into the nitty-gritty of the test itself. What is it all about?
So, what on earth is PSA? Well, it stands for prostate-specific antigen. And really, it's just a protein that's made by your prostate cells. That includes both the perfectly healthy ones and, you guessed it, any cancerous ones too. The PSA test is simply a blood test to see how much of that protein is floating around in your system.
So when you get the result back, what you're really looking at is a number. And the level that doctors are generally on the lookout for is 3 nanograms per milliliter or higher. That's usually what's considered a raised level. It's kind of like a flag, you know? It suggests there might be something going on with your prostate that's worth looking into a bit more.
But, and this is a really, really big but, a raised PSA does not mean you have cancer. Not automatically. There are so many other things that can make your PSA level spike. It could be something as simple as a urinary infection or non-cancerous enlarged prostate. It could even be because you went for a long bike ride recently. That's why it's just an indicator, not a diagnosis.
Okay, so this is where it gets tricky. This brings us right to the heart of the matter, the two very different sides of the PSA test.
And this is exactly why it's such a tough decision. In fact, because of all these trade-offs, the UK's National Screening Committee does not recommend a nationwide screening program with this test. They just feel it isn't reliable enough. And here's why. On the one hand, yeah, it can spot cancer before you have any symptoms. And, crucially, it might find a fast-growing, aggressive cancer early enough for treatment to cure it. But then there's the flip side. It can send you down a rabbit hole of more tests and maybe find a really slow-growing cancer that was never going to hurt you, which could lead to treatments and side effects you never actually needed.
And just to really hammer home one of those downsides, even if your result is normal, it's not a 100% guarantee. About 1 in 7 men with a totally normal PSA level might still have prostate cancer. It just goes to show you this test is far from perfect.
So let's say you take the test and your PSA level does come back high. That uncertainty can be really stressful. I get it. So let's just clear up what actually happens next.
It's a pretty clear pathway, actually. First, your GP will talk with you about referring you to a specialist at the hospital. You'll meet with them. And here's the key thing. What usually happens next is an MRI scan. This gives doctors a really detailed picture of your prostate to see if there are any suspicious-looking areas before they even think about doing anything more invasive. It's only if that MRI shows something unusual that a biopsy might be suggested.
And listen, even if a biopsy comes back and confirms there is cancer, it does not mean you're rushed into major treatment. For a lot of slow-growing cancers that probably aren't going to cause any harm, the standard approach now is something called active surveillance. It just means keeping a close, safe eye on it with regular tests, which lets you avoid or at least delay treatment and all its potential side effects.
So, we've covered the what, the why, and the what next. Now, it really all comes back to you and making your own personal decision.
I think this quote from someone's personal experience just sums it all up perfectly. A good doctor isn't going to tell you what to do. They're going to lay out the pros, the cons, all the limitations, and then give you the space to make the choice that feels right for you. So to help you think it all through, here are a few key questions to maybe ask yourself. First off, what's your personal risk? Then, think about how your mind works. If you got a normal result, would that actually reassure you, knowing the test isn't perfect? And what if it's high? Are you ready for what comes next? And this is a big one. How would you feel about just monitoring a slow-growing cancer versus feeling like you need to treat it right away? There are no right or wrong answers here. They're all yours.
And that's where we land. This isn't a test with a simple yes or no answer. It's a balance. It's a series of trade-offs between the chance of early detection and the risk of overdiagnosis. So the question we'll leave you with is this. Now that you know all the trade-offs, what's the right choice for you?
If you want to dive even deeper into all of this, there are some really fantastic resources out there. The websites for Cancer Research UK and Prostate Cancer UK have tons of detailed, reliable information to help you continue this conversation with your family and, of course, with your doctor.